As long as the virus is replicating somewhere, it's likely to be mutating. So we have to get ahead of this.
By now, you've most likely seen the concerning headlines about the COVID-19 Delta variant, first detected several weeks ago in India. And in some parts of the U.S., it is well on its way to becoming the dominant strain. And with that comes a lot of questions.
A lot of questions. So tonight, Caitlin Ross is getting you answers. Caitlin?
The Delta variant is relatively a new mutation of this COVID-19 virus that's considered much more contagious. A lot of you have been hitting up Google to learn more about it. So we took some of the most popular questions to Dr. Jayne Morgan with Piedmont Hospital. First up, how fast is the variant spreading in the U.S.?
At the beginning of this month, we had about 10% of our COVID positive cases were of the Delta variant. And as of today, which we are at the very end of the month, about 30% of our cases are of the Delta variant of patients who are COVID positive. So we are seeing this Delta variant continue to gain a foothold here in the United States.
The number of Delta cases is still very low here in Georgia. According to the Department of Public Health, the Delta variant only accounts for 0.4% of our infections. That's in contrast to the Alpha variant, which right now accounts for 60% of Georgia infections. Another popular question people are Googling, do vaccines work against the Delta variant? Dr. Morgan says that depends which one you got. The Moderna and Pfizer vaccines are performing very well.
Their efficacy drops to the 88 percentile range, but still incredibly high, incredibly comfortable. What I haven't seen yet is where that efficacy is with the Johnson & Johnson vaccine, and I hope that that data will become available soon.
Next up, is the Delta variant more deadly than other COVID-19 strains?
One thing that we will say is that it is more successful. So it is fitter, it binds to lung receptors with a greater affinity, it has a greater ability to have some evasiveness to our vaccine. For those who are not immunized, however, people have become quite ill.
With that information, a lot of families are asking, do we need to be more careful in social interactions or start wearing masks again? I'll ask Dr. Morgan for her guidance on that tonight at 6.